In this video, we are going to talk about the healthcare delivery system in USA. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. Let's begin this lesson with a question. Is it more likely that someone who is born in the United States will have a longer or shorter lifespan than someone who is born in another industrialized country? It's an intriguing query, aren't you going to agree? Have you ever brought it up in conversation with your friends? When it comes to friendship, the topic of healthcare can sometimes get a little bit sticky. When it comes to determining which strategy is the most effective in meeting the health requirements of the people living in a particular country, everyone appears to have their own view of what does and does not work in this regard. The current healthcare delivery system in the United States is a conglomerate of different health practitioners, agencies, and organizations. These entities all have the aim of providing healthcare to patients, but each carries out its duties in a manner that is more or less autonomous. The majority of patient services are performed in offices and clinics by medical professionals who charge patients on a fee-for-service basis. This accounts for the vast majority of all patient services. The majority of people in the United States receive health insurance benefits through their place of employment. These benefits are paid for by contributions made by both the employee and the employer. However, due to the rising costs of medical care, there has been a shift from unmanaged plans to managed plans, in which utilization is closely monitored. The percentage of American citizens who do not have health insurance keeps climbing, and despite the fact that the American healthcare system has been hailed as the best in the world, critics have criticized it for being the most expensive, ineffective, wasteful, and unfair of all the industrialized nation's healthcare systems. The provision of medical treatment in the United States evolved from that of a neighborhood family practitioner to that of bigger group practices. In many cases, a member of the patient's family might be instructed to carry out the physician's recommendations with no assistance from other sources being required. The family gave the doctor everything they could afford, and it was standard practice for them to barter. The establishment of hospitals made it possible for medical professionals to see all of their patients in one location and enabled nurses to provide treatment to a greater number of patients at the same time. People who were wealthy enough to afford the services of physicians and nurses were the ones who received medical attention. Those who lacked the financial means or other resources necessary to pay just made do without access to expert medical treatment. When Medicare, Medicaid, and health insurance provided by employers entered the picture, this method of paying for medical care was replaced with a different strategy. Despite this, there were still roughly 15% of Americans who did not have access to private health insurance and lacked the financial means to purchase it. The Patient Protection and Affordable Care Act, more commonly referred to as the ACA, was a step in trying to reduce that gap, and it did so, to some degree. Prior to the Affordable Care Act, individuals who did not have health insurance coverage were unable to purchase health insurance through the insurance marketplace. They may or may not be able to get assistance paying for the insurance depending on the amount of money they bring in each month. Many individuals choose to go with plans that had lower monthly expenses so that the whole expense would be more manageable. Unfortuitously, the plans with the reduced premiums also came with greater out-of-pocket costs and deductibles. When the individual sought to use his recently acquired health insurance, he was confronted with deductibles of $5,000 or more that had to be satisfied before the insurance would pay for the treatment, and this was in addition to the co-pays that were required. In actuality, these people were not insured in any way, shape, or form unless there was an unexpected medical complication. How does this situation stack up against the universal health care schemes offered in other nations, given that coverage is still not provided to everyone? To start, let's talk about what we mean by universal health care. The majority of developed nations, with the exception of the United States, have implemented some form of universal health care coverage for their citizens. Universal health coverage, also referred to as universal health care, UHC, is a term that was coined by the World Health Organization, who, to to describe a system that ensures all individuals receive the necessary medical care without putting them in a position where they are unable to afford it. According to the World Health Organization, WHO, the goals of healthcare systems are maintaining a healthy population of citizens, adaptability to fulfill the needs and requirements of the populace, suitable methods for financing the operations. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.